It was national news last week. A London teenager was hospitalized with a severe pulmonary illness. The Middlesex London Health Unit said it was vaping that made the student so sick. Since then, when the officials made the announcement, vaping manufacturers and shop owners across the country began calling on the health unit to reveal the name of the vaping juice the teen was using. They're also challenging the allegations that vaping is harmful. Jonathan Marshall is the founder and president of Flavour Crafters. It's an e-liquid manufacturer that's been based in London since 2012. And Dr. Chris Mackie is medical officer of health for Middlesex London Health Unit. Good morning to you both.
Good morning. Good morning.
Jonathan, I'll start with you. What was your reaction when you heard the story that this young person was hospitalized and we were pointing the finger at vaping?
Well, I was pretty concerned when I heard this. I had been following the news from the FDA in the States regarding their outbreaks there, which obviously is what triggered our interest in this here in Canada to pay attention to these kind of cases. And, in the United States, it had been linked, or not necessarily linked, but the FDA is following an additive for THC cartridges, which are on the black market called vitamin E acetate. They did testing on samples they recovered and found it in over 50% of those, and over 85% of the patients that they had with this condition in the States admitted to using THC cartridges. So when it was brought up in London and pointed at the vaping industry in general, like especially nicotine replacement vaping, it was kind of surprising, to be honest, because I don't see any link to how an ingredient like that is being linked by the FDA to this condition could find its way into our e-liquid. In fact, we're making a water-soluble product, and vitamin E acetate actually it would float on top.
Dr. Mackie, can you just break it down for us? What exactly is the link here in London between vaping and this person who ended up in hospital?
So this was a young high school-aged student who had no other pre-existing illnesses, and at the time of this person's very severe illness, the physicians investigating could find no other cause. Now, there was no lung infection, no sign of lung cancer, no reason for this person to be so extremely sick. They were on life support, required intubation, a very severe case. The only thing that the physicians could identify as a potential cause was that the person was a heavy vapor. Now, we know from research that vaping affects the body in a similar way to smoking. If you look at the bloodstream, you take samples of somebody after they vape, you see the same sorts of chemicals as after somebody smokes a tobacco cigarette. There's lots of signs of inflammation, that the body's being damaged by the vaping. So it's no surprise that vaping would cause lung-related illness in this case.
Is there should we differentiate between whether or not what was being used in the vape had THC in it or not? I mean, because that is some of the concern here, I think, from the industry.
That's right. And there really are two stories in vaping. There are vape shops in London, for example, that are great at making sure that they sell only to adults of appropriate ages, that they're using liquids that are as high quality as they can get. On the other hand, it's also very easy for youth to order online products that might have come from a country where manufacturing standards aren't what we might expect in Canada. So it's very easy to acquire a product that might have those risk factors.
Jonathan, tell me a little bit more about what vape juice actually is and where yours come from, and if there's any risk that there's THC in it.
Of course, yeah. We manufacture our vape liquid here in Canada in London, and we get a USP grade propylene glycol, which is a common carrier used in the food as well as pharmaceutical industries. It's used in food flavorings, it's in soda, toothpaste, all sorts of things. It's also pumped through hospital airways since about 1950 as an airborne disinfectant. Also, then the other carrier is vegetable glycerin. This is used in firefighters' training drills, for example, to simulate smoke. It's used in nightclubs to make the fog when the fog machine's on. Both of those are considered relatively safe for human consumption. Other than that, we use food-grade flavorings, the same type that would be used in food applications, and then pharmaceutical-grade nicotine. We deal with reputable Canadian American suppliers for these ingredients, such as Brentag here in Canada, and only acquire USP grade ingredients which are tested by those manufacturers before we acquire them.
So no THC in your juice?
No, quite frankly, THC is a fixed oil, and we're dealing with a water-soluble product. All of our ingredients are water-soluble, meaning if I put it in water, it would mix easily. Even as an example here, I've put a little bit of vitamin E. I mean, the viewers can't see this, but I put some vitamin E into propylene glycol and vegetable glycerin here. And as you can see, the vitamin E is just floating on top of our e-liquid base. It doesn't mix. It's impossible to mix vitamin E into this product. And with the FDA putting the finger towards vitamin E acetate as an additive in the States that's causing this lung condition, I would put this out there that it's very, very difficult to get these to mix. I have not been able to do it. So I don't know how it could possibly get again into our e-liquid. THC would float the same way. It's oil.
I am curious. We've seen a push from the industry to find out the brand of the vaping liquid or the vape that the teenager here in London had been using. Is that something that you also want to know?
Absolutely. I mean, I've done a recall before. A lab previously, when we sent off for lab testing, which we do every 6 months, they mistaken a spike in our tests. They mistook propylene glycol for diacetyl, which is a harmful flavoring additive. So we did a major recall. That was back in 2013. Vice actually did a piece on us when we did it, and we did it because it was the right thing to do. When the lab retested the flavor, they found no detection of diacetyl and realized their mistake. But we still spent over $12,000 pulling that product off the shelves because we wanted to make sure if there's any risk to our product, we addressed it right away and got it off the market.
So you want to know the brand in case you need to do a recall, you're suggesting?
I think any manufacturer in Canada deserves that, and also the public deserve that. If you're out there, I mean, I'm hearing reports from a lot of people in the industry that their customers have been going back to smoking out of fear. They're going back to the variety store and buying cigarettes. They're not going to the pharmacy and buying gum or patches. They're going back to smoking.
Dr. Mackie, why don't we know the brand that this particular person was vaping?
So it's our role in, as we release this sort of information, to protect the privacy of the individual in question as much as we can. And so because we have released some of their healthcare details, we are not releasing anything that might lead someone that knows them to recognize who we're talking about. This is...
But isn't there a greater general need or reason why you would share this with the public?
If this were a brand-related issue, then knowing the brand would be important. What you're seeing in the cases, over 500 cases across the U.S., and the 8 deaths that have happened in young people after vaping, is that there is no particular brand at play. THC is not an issue in the situation that we're talking about. The individual did not report using THC. And again, it crosses many, many brands. There's also a phenomenon where some brands are also wholesalers, so their product could be in all sorts of other different brands. What we will know as we gather more information systematically on this problem is there a link with brands here in Canada? We can't say that from one case, and so to say this is the brand and all those other brands are safe, that's just not the case.
So vaping can make you sick even if it doesn't have THC. Is that the message that you are suggesting?
That's right. And so you heard talk of a chemical used in fog machines at, dance clubs. Have you ever gone to one of those fog machines and just put your face right up there and sucked in all the fog at once? No, you wouldn't do that, because anytime you're heating a chemical and putting it into your lungs, there is a risk, there is inflammation to your lungs, and it can cause problems, especially in vulnerable people.
Jonathan, I'll give you the last word for now. How do you want to respond to that?
Well, you mentioned there, Dr. Mackie, that you had a report from the patient that they did not use THC. But considering the public health risk of having products that you claim are harmful to our health, even though they've been regulated and approved by Health Canada at this point, and you know what I mean, like our government, the Liberal government brought in a regulatory process to make them legal and available to tobacco smokers. My question would be, was any further testing done on this individual, this patient, by for example, blood test, urine test, or hair test to determine if they had THC in their bloodstream? Because I feel like with the FDA especially, they linked 85% of the cases in the States to THC use off the black market. So I feel like that would be a pretty logical step to do a further test rather than just taking a minor's word on it that they didn't consume THC, especially when, if I was 17 years old and I was vaping or smoking and then using cannabis, the report towards cannabis use, especially from parents to their teens, is still very, very strong.
Okay,
so
I'll give Dr. Mackie, we don't have a lot of time, but if you want to respond to that.
Sure thing. This is really not an issue where we're going to go into the legal status of the youth in question. It's not a policing issue. What our job is to do is to find the risk, inform the public. There is definitely a risk with vaping. I want to be really clear. Vaping is safer than smoking cigarettes. So if you're a smoker, vaping might be the right choice. But we're seeing an explosion of vaping among youth right now, especially because it's so easy to acquire vaping products online. And we're getting a whole new generation addicted to nicotine. And that's going to cause big problems down the line.
Okay, we'll leave it there. Thank you so much to the two of you for coming in this morning. I appreciate it.